you're going to go to your doctor hoping that Western medicine is going to keep you healthy, prevent disease, and make you live longer. You're going to have a better quality life. That's not true. The problem with Western medicine, and what's great about it, is that if you come to us, if you come to a traditional Western medical system, not me, they're going to do everything possible to prevent something bad happening, which means they're going to have to intervene in a lot more people to help that one person have a good outcome. The downside with that is for all the people who had an intervention that didn't work, those people still suffered some harm. Classically, this is a patient who goes to their physician and has their annual blood tests done. Then we find one thing, then we find another, then we find another, and all these tests that we do, all these interventions that we do, and in the end, the person really didn't have a better outcome. So in fact, going to a doctor, going to a Western-trained medical doctor has a risk. We know that as physicians, and that's why we're very careful when somebody says, yeah, I've also been having some chest pain. Okay, let's call 911. Why don't we just call 911, right? We could just send them to the ER, get a bunch of tests, and that chest pain could be a heart condition. And yes, if you send everybody who complains even of a little bit of chest pain to the ER, you're going to find a bunch of heart attacks. But those were not the kind of heart attacks that was going to cause any harm in that person. That person was going to live just as good of a life, if not better. And now you took a bunch of patients to the ER who had tests done, where you find a bunch of other stuff, you intervene and you kill a bunch of people, you cause a lot of harm, what's called iatrogenic harm. So how do you figure this out? How do you balance this? And am I just causing fear, unnecessary fear in people? No, I'm not. Look, you develop a wonderful relationship with your doctor. You get to know your doctor. You develop a plan for your healthy aging. You develop a plan for what health means to you and not to your doctor, not to Western medicine, which tends to practice a little bit more defensively, obviously, because of medical legal risk. But you determine what is right for you, and you have that discussion with your doctor, and that is what you guys are going to aim at.